yesterday we kind of launched our COVID questions here at KSWO. We've had lots of people already emailing us with different questions regarding coronavirus, vaccines, the pandemic. But the main one that we were getting was people upset that they register and then when they go to book an appointment, there's just none available. So can we kind of talk about why that is?
Sure. One of the biggest reasons, so we've tried to distinguish our appointments from first dose, second dose. So if you are looking for a second dose, you received your first dose in Southwest Oklahoma at one of the county health departments, and you're looking for your second dose, you should have an appointment spot available. We put plenty of appointments in for our second dose. First dose is a different story. So we're in the week where we're having to provide the second dose for a lot of people. So in District 5, Southwest Oklahoma, we gave just about 5,000 shots in 1 week, and then over 9,000 the following week. So it's time for those individuals to come back and get their second dose. So it really comes down to a matter of resources, human resources, as well as vaccine supply. And so that's why you're seeing a fewer first dose appointments for the coming week, but it's going to get better. This was a huge surge when we tried to really do a big push for the vaccine initially. It's going to get better that second week of February.
Perfect. So basically, for those people who are upset that they're just not getting an appointment, what do you tell them? Do you just tell them to, keep trying, or, what do we do?
Well, we do tell them to keep trying, but that doesn't necessarily help. That's not the message most want to hear. Again, we post our appointments on Wednesday evenings and Thursday mornings. That's the best time to find an appointment. If you don't get an appointment on that first week of February, which is next week, there will be more appointments coming that second week of February. And I also just want to remind everyone, we're not going to be the only game in town. As vaccines come into our state, we're going to be pushing out vaccine to other providers, doctors' offices, pharmacies, hospitals. We are anxiously awaiting the time where we have the vaccine supply to do that. And so vaccines will become more readily available. It's just right now we do not have the supply.
Right. And I think actually the OSDH sent out an email yesterday kind of detailing some of the numbers. I want to say it was somewhere with around 500 to 600,000 people who had registered for the vaccine. And so that compared to, I guess, however many y'all have, I guess would matter, right?
Yeah, it matters. And the other piece of this, and we're not holding back second doses, but we do plan ahead. So we're planning for next week. And I know I need to have 9,000 vaccines available for those second dose those second dose individuals. So that vaccine is dedicated to the second dose individuals, which means the rest of the vaccine that I have will go to first dose. But again, it comes back to human resources, the facilities that we have available. Can a facility accommodate 2,000 people coming in one day, and us being able to maintain those social distancing standards? So it's not, if it were as easy as a flu shot, we have proven over and over again, we can give out thousands and thousands of flu shots in a single day because we can do a drive-through. This vaccine is different. The temperature monitoring is different. There's a monitoring wait time of the individual after they get the vaccine. That causes a little bit of difference. And then just the population that we're vaccinating right now, we have to have some considerations as far as mobility issues.
And then last question real quick, cancellations on appointments, is that something that people could kind of check in daily to see if other people have canceled appointments? Is that a way to kind of get in there?
That is a very good point, because what we have found is, and we get emails, you get emails when you open this, you ought to see our Facebook Messenger page. Our staff are answering emails all the time. So yes, if someone has an appointment and they can't make it, we are asking them, please go in there and cancel it. Even if they call us or send us a message, that particular app doesn't allow us to go in and cancel for anyone. So you have to cancel it yourself. And then yes, it will open it back up so someone else can. So you may hear one day that it's full, you can't get in, and then your neighbor gets an appointment the following day. And it's like, wait a minute. And it's because someone canceled and they just happened to get in at the right time.
Right. Well, of course, plenty more questions about COVID, and we'll get to those just, every day as they come in. So thank you so much, Brandie, for talking to us today.
Thank you.